in December of 2019. Most of them seem to be associated with a market in China. So there was this cluster of pneumonia cases, and we saw it spread throughout China. This is similar to what we've seen before with SARS viruses in the past, but we never had it spread this far. SARS initially, the first SARS virus that we saw was concentrated in certain areas, some of the large cities like Toronto and things like that, but it never got widespread throughout the entire world. But so that's where it started, was in that from that cluster of illness in China, and then it started to spread to other parts of the world. And we in the United States initially, we were monitoring individuals who were returning to the United States from China and other parts of the world. We were, they were quarantined, and we were, as public health, we would check in with them, for at that time 14 days, and asking them each day, are you having any symptoms? We'd give them phone calls, we'd call them, we'd text message them to see if they were experiencing any symptoms. So, but after a while, it got pretty much too big to control it. But, as it spread to other countries, there was no way that we could keep up with all the different countries that were having outbreaks and, people returning from those countries. And I think in terms of what we could do to control things, it was difficult, in our society to be able to implement the measures that would have been needed to control it. We're not a country that will, kind of force people to isolate, force people to quarantine, in hotels or hospitals and things like that. So we're an open society, and those things wouldn't go over well here. We could have closed the borders, but obviously we're free market society where people are free to move about the country and the world as they please, and so closing the borders wasn't really an option for us. I think the one thing that we could do or could have done is really implement control measures earlier, mostly due to masking. I think early on we shut down schools, we shut down gatherings, we asked businesses to close down, we asked people to isolate in their homes and avoid going out, lockdown, if everybody remembers that. But masking was probably one of the things that we could have implemented earlier. I think if we were hesitant, the CDC was hesitant to recommend masking for people who are out in the community. And finally, when we finally did that, I think it was maybe a little bit too late. And I think a lot of us think that had we done that earlier, we could have, not stopped it necessarily, but we could have done a better job containing it and maybe slowed its introduction here in the United States.